I'm with Dr. Keating here today. Like, man, we've gone way back. We've been friends since college. And so we were both in the kinesiology program at Kansas State University. And we always just kind of love bouncing ideas off each other, improving each other, learning from each other. I ended up going down the path of strength conditioning and nutrition. And Mitch ended up going all the way through chiropractic school. And so he is now a sports chiropractor. And man, you're killing it. You're doing super well. You're growing your career every year.
Yeah.
Definitely
Well,
all the ups and downs and challenges, but you've had some incredible experience already. So thanks for joining me today.
yeah, absolutely. Absolutely.
Dude, okay. So I get this all the time whenever if I ever recommend a client to go to a chiropractor to get an adjustment or to deal with some soft tissues issues they might be having. They're always like, but isn't the chiropractor just like the dude who pops your back and your neck? Like, I'm kind of scared of
Yeah.
that, Okay. So I just
Yeah.
feel like there's this huge need, this huge like misconception out there of like what a chiropractor actually is. And I think a lot of my listeners, even from different places around the world, may have never even heard of a chiropractor. So what is chiropractic medicine, especially like from the sports chiropractic side?
Yeah. Yeah. So, you and I've had several conversations about this over the last several years as we nerd out and talk
Yeah.
about sports med and training and different things. And our wives probably get annoyed at how long those conversations go.
Oh, yeah.
I think it really kind of boils down to chiropractic as a whole is a profession that specializes on treating muscular and skeletal dysfunction. Now, we own neck and back issues as a profession. That's what we're known for. And the doctors evaluate patients and, properly diagnose whether it's a issue with the joint, muscle, tendon, ligament, nerve, etc. And then obviously have treatment options for that. I think what has been interesting is as the profession of sports chiropractic has really grown, is really how that is adapted and how that's morphed into treating athletic injuries. And so, I would say, again, this is just my opinion. I would say over the last 40 years, chiropractic has had a change in the sports medicine realm. And so you see these subset specialties of chiropractic sports physicians and diplomates of that. And then you have different soft tissue treatments that have come out and kind of adapted or developed to treat repetitive overuse injuries and obviously incorporating rehab. So I think it's kind of this, I would say the best way that I describe it to my patients is that there's a family practice MD, right, that takes care of you and your family and your health issues. And there is a sports orthopedist that focuses on athletic injuries. And then there's a pediatrician that focuses on, kids under 18. And chiropractic is kind of the same way. You can specialize in treating different things. I've gone down the road of, as you mentioned, just working with athletes and treating, sports injuries. So I get that a lot. They show up with a shoulder injury into my office and they go, well, I don't know why I'm here. You only work on back stuff. And then I, politely tell them or sarcastically tell them if, you got a good vibe with the patient that I treat more shoulders than I do back pain, and their eyes kind of, light up or get big. And so, I think that is a misconception. As a profession, we have to do a better job of educating our patients. We have to do a better job of showing the value that we can provide in the sports teams that we work with or with the athletes that we work with and treating and managing a variety of issues. Obviously, I'm biased with what I do, but I think as I've learned and I've been around some of the docs that work with, Team USA or some of the pro teams in the US, that as a profession, we offer certain things in athletics that other professions don't. We're very much hands-on practitioners that incorporate rehab and manual therapy and manipulation or adjustments. And that's not to say that there aren't PTs and athletic trainers that do that. I would just say as a whole, chiropractors are a little bit more hands-on in addressing the issue. I don't know if that's exactly, what you were
Oh yeah.
referring to, but
That's fascinating. That's cool. So like you mentioned like athletic injuries, but is that like only for athletes or is that also for like the recreational athletes, like the average guy or the average gal who's just trying to be physically active and they end up hurting themselves?
You mean like washed up athletes like you and I, like used to be athletes
Yeah,
who
the
still
wannabes. Yeah, the
do
wannabes.
it?
People who wish they're athletic and, they try to work
Um,
out and play sports and they end up getting hurt all the time.
for sure. I think everybody to some extent is an athlete, right? You may not be a basketball player, you may not run track, you may not do, Olympic weightlifting, whatever it is, but you have to do athletic movements all day, every day. When you're 65, you want to pick up your grandkid, that's an athletic movement. When you're, trying to garden in the weekend and you're lifting bags of mulch and you're taking it around all the flower beds, that's an athletic movement. And so that's part of the first conversation that I have with a patient. I said, hey, here's my background. Here's what I believe. Here's how I treat and work with my patients. And here's the why, is because we all have to do this stuff.
Hmm.
Whether you have this make believe, belief about yourself that you still can hack it on a basketball court or not, you still have to be able to move around your house. You still have to be able to do these things in the short term and in the long term. And then you kind of work with them through that.
Yeah, yeah. And you specifically do what's called ART, and that's, what is that, active release technique?
Yeah. Yeah.
Yeah.
Active release techniques. Yeah. Awesome treatment. Game changer when I learned it.
Yeah. So like I want to dive into that a little bit because like chiropractic, especially when you use the thing like ART, it's much more than just like cracking your joints or anything.
Sure.
It's much more involved. Can you describe like why is that becoming more of why is that catching on, especially across like treating soft tissue? And soft tissue means like your muscle, your connective tissue, your joints and your ligaments and tendons, like working with everything. It's all a connected system, right? And so like how
Yeah.
does ART addressing that?
Well, I think the reason it's becoming more prevalent is the results that you see on the back end. I
Mhm.
think manual therapy or soft tissue treatment has been around for thousands of years, right? ART was developed by a chiropractor out of Colorado Springs that worked with the Broncos for the last 20 years.
Hmm.
He developed a system in which that you can identify where a tissue adhesion or scar tissue is occurring in the muscle. You can isolate that. And then there's different protocols to treat the individual muscles. I'm one of ART's elite providers. I've drank the Kool-Aid, so to speak. And, I've learned a lot over the last 7 years of practicing and continuing to learn on that technique. The piece that was interesting to me is, we all learn the hard way, right? Every once in a while we get lucky and learn from somebody else, but most of the time we learn the hard way. I tore my ankle in chiropractic school, and it was the second time I tore it. And because I was a student, I was basically a cheap lab rat for the university. And
Oh,
so
nice.
you're paying them to go to school and then they're working on you for free. So that's the benefit of it. But
Perfect.
they did a research study and incorporated chiropractic treatment or joint mobilization, manipulation, adjustments, whatever term you want to utilize with that. They paired that with ART, and that was my first exposure to it. Now, granted, I knew what the recovery time on the first ankle injury was when I was in high school, probably 8 years prior. And so one treatment laid me down, did ART for 2 minutes, and I couldn't take, like, it was extremely sore because the injury was fairly fresh, but I stood up and I was 60% better. Pain was less, range of motion was better. I walked down the hallway better, and game on, right? It's like, if
Wow.
that can be my experience with it, then that was the route I was going to go. So I started taking ART courses when I was in chiropractic school and got certified, and then, came out and wanted to, as kind of term, level up on that, and decided that I was going to pursue their elite provider status. And that has opened a ton of doors for me.
Wow.
I've had athletes get referred to me from Australia that are in the States, obviously going to school, but their coach back home said, hey, here's an ART provider in your neighborhood or in your town, and you need to go see him. ART is regarded as one of the top soft tissue treatments in athletics in the US, and it's growing by leaps and bounds. I think the recent study that I saw is ART resolves in 5 visits or less, and don't quote me on this, but a rough estimate, right? In 5 visits or less, I think the study said 75% of issues were resolved, regardless of the cause, regardless of the diagnosis.
Wow.
Within 7 visits, it was 90%. So if you're talking about 90% of issues from a connective tissue, musculoskeletal standpoint being resolved in that time frame, that's a game changer. And
Yeah.
so in my practice, pairing that with rehab and chiropractic work, the results kind of speak for themselves. Now, does it fix everything? No, there's no magic bullet, but it definitely improves the outcomes for patients.
Wow, that's amazing. That's fascinating. I mean, I remember specifically like one time, like I came to you and like I had like shoulder surgery several years ago, and I came to you, I was like, dude, my shoulder's stiff, it's not feeling good. And like you're one of those chiropractors, like you know whenever you have a good chiropractor, whenever he's just like he can see with his hands. Like you're just like feeling around, you're like, hmm. And I'm like, okay, he's seeing me, he's seeing right through me. Like it's like you don't need an MRI machine, you can feel it. And then you just stuck your thumb like all the way through my shoulder and moved it through some motions, and I was like, oh my goodness. And then but afterwards I was like, I had like significantly more range of motion and pain was good. I'm like, wow, that's a single treatment and that was a significant improvement. So it's legit stuff.
Yeah. Yeah. And I think the beauty with ART, and this is where I get passionate about it. Does it fix injuries? Absolutely. But the
Mm.
prevention of injuries and being able to feel tissue when it's fatigued and wore out and being able to help give that a little bit more recovery, that's been awesome. I'm working with a Team USA athlete right now, or a potential Team USA athlete right now, who's top 5-10 in the US. Kind of hard to know where they're at right now because I haven't had a meet in a year. So, but
Yeah.
that's where they think they're at. And this athlete, from a repetitive injury standpoint, was accumulating nagging issues 3-4 times a year. Well, knock on wood, over the last 10 months, hadn't had to shut down for an injury. And I mean, we've been working on this guy consistently to try and up his game and to perform better so that these nagging soft tissue injuries aren't a part of it. And that's really where the joy of it comes into play with using that technique. So
That's awesome. That's fascinating. It kind of leads into the next question about just like the central nervous system. The central
yeah,
nervous system is like your brain and your spine. And like that is like intimately connected with everything in your body, right?
yeah,
And
yeah,
I mean, this is just fascinating to me because like coming from my profession is strength conditioning and nutrition, like I see how especially in a world where people are just looking for the next intense workout, where things like CrossFit are super important. I'm very involved in like the CrossFit world, high intensity work, because it's like super effective. But you can get people who are getting overexcited about it, and even within the athlete realm where I've worked with athletes who, like, whenever my first meeting with them, I'm like, dude, your body's broken, like you've been training too much. Overtraining is a thing. It's a big thing nowadays. And if you overload your central nervous system, which is basically saying like, I want you to be firing at all times, whether that's like from bad sleep or overtraining and poor nutrition, like it's an all inclusive thing.
sure.
But whenever your central nervous system gets overtaxed and it's just worn out, like you're going to start compromising here and there, and then the soft tissue injuries end up showing up all over the place. And so, like, how do you see that in your practice? How do you address that? How can you explain that for listeners today, like how the central nervous system is so um, important to be aware of and address?
Well, we're gonna get in the weeds today, huh?
Mm, mm,
uh,
I'm ready to learn. Let's go.
yeah. Well, I think part of that's a huge topic, and that's something that you could spend an hour talking on that alone, and
Yeah.
the facets of that and what affects it. As you mentioned, brain and spinal cord is what controls every cell in the body, and I don't think we don't take a step back and stand there and look at that and go, oh wow, and appreciate the complexity of that. It's extremely hard to study the effects of the CNS on injury, in my opinion, because of the variables that you have to consider. Well, what was
Mm,
the athlete's diet? What was the athlete's sleep schedule? Were they mid training in season or were they off season? Right? It's like you can't study all those things really effectively. You have to break it down and segment it out. So, you know, first point would be that we know nothing. We know stuff, but we don't know how that fits into the overall puzzle 100%. And that has to pull research from multiple disciplines to get a clear understanding from that.
Mm.
This is my personal opinion, my clinical opinion. I think with a lot of the athletes that I work with, especially the high end athletes, central nervous system fatigue is something that is underappreciated. It's just this chronic demand that the body puts on the CNS, whether it's from training, whether it's from studying and stress and, life,
Mm-hmm.
having kids, not sleeping well, like you mentioned, not having great nutrition. We don't know the effects of that. I had a doc put in front of me a research paper that questioned if the delayed onset muscle soreness, the soreness that we get from training,
DOMS.
is that something that is actually a component of the nervous system, right? Is the soreness not muscular in nature? Is it the soreness created by the CNS? That paper was not definitive in that, but it was questioning everything that we know, right? And
Yeah.
and I think that's fascinating. So, I think for me, you can quickly identify when an athlete is smoked from a CNS standpoint. And the story that I use to explain to an athlete really what that is, I trained to get better at a certain movement. I think it was snatch for 8 months. I mean, consistently working on that week to week. And my 3 rep max, my 5 rep max, those were all improving, but my 1 RM was not moving. So I'll never forget this. I went to the leg for July 4th, didn't work out for a week, ate like trash, slept a ton, came back the next week and hit 2 PRs. And so it wasn't what I did at the lake, directly that made me stronger. I joked with my strength coach that if all I have to do is eat bad and sleep a lot to get stronger, that's no problem. But I think the piece it was just the drain or the taxing of the CNS that was preventing me from going up. And I came back the next week and hit 2 PRs. And, I think a lot of us are like that. We train, we're disciplined, but we ignore the recovery that the body needs. We could talk about that all day. I don't know if that's too in depth. I don't know if that's what you
Oh,
were
that's
exactly.
totally true. I mean, I think overtraining is a major thing, whether that's people like jumping into an exercise program like full bore from nothing and they just totally beat themselves up, or maybe you've been doing it for a while and now you're totally plateaued and you're stuck and you're starting to have these nagging injuries. That's a sign that your CNS is just like blown up and you need to actually cut back a little bit, and you'll
Yeah.
get more out of your training by allowing yourself to rest. And like we've kind of addressed a little bit, it's like an all-inclusive thing. It's not just your training volume, it's also your sleep, it's your life stress in general, be that from work, family, whatever's going on in your life, but also
Yeah.
nutrition, like all of these things. It's a all inclusive. Your body treats all stress the same. It responds to all stress the same as far as like how it tunes you up. And if you're like in a really stressed state, it affects your hormones, it affects your CNS. And if your CNS is firing, your sympathetic nervous system is firing all the time, it's going to wear you out and you're not going to be able to perform or feel the way you want to.
Yeah. Yeah. It's fascinating. And I think the hard part for people is sometimes we don't know which angle to study it from. It's
Mm-hmm.
like it's a faceted issue. And so it's like, well, is it sleep? Is it recovery? Is it nutrition? Is it training volume? Is it the fact that, my work is super stressful over the last 3 months? Or why am I getting, nagging soft tissue injuries in my leg and my arm and my shoulder all at the same time? It's like, well, yeah, it's all of that. And the other part with that is we know that the spine has a lot of proprioceptive fibers. We know that there is a very close relationship with spinal function with CNS, but I don't think we 100% know what that is. I think anybody could look at a skeleton and go, because of how close they are, because of how the nerves exit the spine, there's probably an important relationship there. But I think we're infants in terms of the knowledge that we have of that. Maybe we do this podcast in 40 years. I'm sure both of us will look better, but we'll have more information for sure.
For sure. Yeah.
So,
Yeah. But yeah, I mean, for practically, I feel like kind of what we're hitting at there is like, it could be a number of things. And so maybe you think of like the biggest thing or like the low hanging fruit, the easiest thing
yeah,
that you could
yeah,
address. and do one thing at a time and try to be consistent at that. So if
Sure.
your sleep's awful, then try to get an extra hour of sleep every night and see if you can build on that. Or if you're just totally beat up, go see a sports chiropractor,
Yeah. Yeah.
maybe cut back your training volume for a couple of days at least, or for a week to let your body sort of recoup. In the grand scheme of things, if you get back to your exercise program, it's not going to hurt your overall fitness.
Sure. I agree.
So
100%.